Hi, I'm Dr. Jennifer V. Brown, your stroke specialist, and I'm aging gracefully with the stroke diagnosis due to sickle cell disease. We're going to discuss how to improve walking. If you want to improve your walking, you need to train walking. To improve muscle strength for walking, I'm going to show you some things to do. Okay? Let's get started. So, a lot of people will say you need hip extensors to push off, and your foot needs to be pushing on something. And we do it in sitting because we're afraid to stand folks up. But what's really missing from this? And look, this person is simulating the push down that you need. Do we need that TheraBand a little bit more at the forefoot to simulate pre swing? Yes. But there's a bigger issue. What you really want is to be standing with a trailing limb so that you can learn to roll over that foot and push off of that foot. So, how do I do that? I get them walking backwards with the TheraBand. Look at this. So, when he comes back, the toe goes down first and he has to load the heel. And when you load the heel, not only are you getting work at your calf, but also at your gluteus muscle. They got to take a long step backwards. Let's look at that again. And then when they put the foot back, you can have them come up with the TheraBand and then push back, push the rolling walker forward and see if they can hold their leg back against the resistance of the band, balancing on their forefoot. That will simulate the task specificity of a trailing limb and having to push off so that you can improve the speed of gait. These are some clinical questions to ask. Is there isolated hip extensor strength without compensatory pelvic or trunk movement? A lot of people can get their leg back, and what are they doing? They're bringing their trunk forward. Okay? Is the proprioception intact? Maybe they can't feel what hip extension with knee extension with forefoot rollover that 60 degrees of toe hyperextension really feels like. You won't get it in sitting. You have to do it in standing with the trailing limb. Here's some other commentary I want to add. If you're going to use a rolling walker, which I do all the time for training because I want bilateral weight and symmetry in use of the trunk, use a hand splint to secure that hemiplegic upper extremity. And the elastic band that you choose to use depends on the strength of the lower extremity, neuromuscular control, sensory motor control. All right? Don't forget about that. Remember, I am your trusted source for all things stroke rehabilitation and ankle foot orthoses. These videos appear on Tuesday and Thursday. Subscribe, like, and share, and leave a comment. And these are the references. Remember, task specificity is evidence in the research. If you want to walk better, you need to train the person in that phase of gait or that segment of gait in order to simulate the walking. Thank you for watching. Bye bye.